It is 10 a.m. everyone. And I know that others will be flowing in. Okay, LeighAnn Brooks, the star of the show, is here. So we are definitely ready to go. Others are going to be streaming in, but it is 10 a.m. and we want to respect your time. We only have an hour. So I want to go on ahead and begin the meeting. For those of you who are new, and we do have some new folks today, which is awesome. So for those of you who are new, we do begin with a meditation in our meetings like this. Health Visions Midwest has 3 locations, and we are owned and founded by the Poor Handmaids of Jesus Christ. So we are a faith-based agency, but of course we serve everyone. We start these meetings off with a meditation. And so if you are not into that, we certainly respect that and we don't want to offend you. Please just turn your volume down for about a minute. And then come back and join us. Felicia Say, who is our admin assistant, and she oversees a whole bunch of stuff, virtual programs, community partnerships, and all types of things. And she is going to lead us in a meditation this morning. Felicia?
Thank you. So this is a meditation that is from the Common Prayer Book, and it's by Shane Caliborn and Jonathan Wilson. So please pray with me. So it says, Lord of creation, create in us a new rhythm of life, composed of hours that sustain rather than stress, of days that deliver rather than destroy, of time that tickles rather than tackles. Lord of liberation, by the rhythm of your truth, set us free from the bondage and baggage that break us, from the pharaohs and fellows who fail us, from the plans and pursuits that prey upon us. Lord of resurrection, may we be raised into the rhythms of your new life, dead to deceitful calendars, dead to fleeting friend requests, dead to the empty peace of our accomplishments. To our pactful planners, we bid peace. To our over-caffeinated consciences, we say cease. To our suffocating selves, Lord, grant us release. Drowning in a sea of deadlines and death chimes, we rest in you, our lifeline. By your ever restful grace, allow us to enter your Sabbath rest, as your Sabbath rest enters into us. In the name of our Creator, our Liberator, our resurrection and life, we pray. Amen.
Amen. Thank you so much, Felicia. I love the over-caffeinated selves that that stuck out to me. Free us from fleeting friend requests. We know we're all getting those types of things, and we're over-caffeinated, and there's a bunch of stuff, but we, in the midst of all of these things, can be sure to have peace and stay on task and focus for the things that we are called to do. So thank you so much for that, Felicia. I know that we do have a few new people that are with us today. So I want to take a few minutes that if this is your very first time with the Allen County Health Equity Coalition, if you could just introduce yourself and say what organization that you are representing today. Who wants to start?
I'll start. Good morning.
Okay. Good morning.
My name is Michelle. I am the Director of Quality Improvement for the nursing program at Ivy Tech Community College. We have 23 schools of nursing across the state, so I oversee accreditation and regulation with all of our schools of nursing. So my background is nursing. I live here in Fort Wayne, and I have had involvements in nursing related activities in other organizations, as well as worked at the bedside for some time before coming into education.
Wonderful. Thank you so much, Michelle. Thanks for coming.
Thank you.
Who's next?
I can go. Good morning, everyone. My name is Aida Calderon. I am the Community Outreach for Familia Dental.
Okay, Aida. Is that correct? Okay, wonderful.
That is correct, yeah.
Okay, thanks, Aida. All right, who else? First time here.
I'm LeighAnn Brooks, and I am the manager for the diabetes care services for Parkview Health System. And I'm here to talk to you a little bit today, just in a little bit, but I have been with Parkview for 23 years, and I am also a registered nurse and a dietitian as well. And I'm super excited to be here and share with you guys a little bit of my vision, as well as my directors, and how we can maybe support your initiatives.
Thank you so much, LeighAnn. And like she said, you'll be hearing a little bit more from her. Who is next?
I can go next, Sharon. Hi, good morning, everybody.
Oh my, okay, come
It's
on.
been a very long time. I am not sure if I have, it's been years. So I wanted to say good morning in case people didn't remember. So I'm Irene Paxia, and I recently joined the advisory committee of Health Vision. So I thought it would be a good idea for me to be here this morning. And I used to be the CEO of Amani Family Services, working with immigrants and refugees locally in Fort Wayne. I have recently made a trip home in Italy and returned as a consultant for inclusion and diversity under the name Petra Solutions. So I'm happy to be here and support the work of Health Visions.
Thanks so much, Irene. And wasn't Lena here? Lena, I can't believe I'm having to call her out because she never has to be called out. Go on and introduce yourself. Lena? I see where she looked like she was trying to talk, but her audio might not be working. Are you there? Okay, something's going on with your audio, Lena. Okay, go.
It's better that I just call and, you know.
Okay, something's going on with Lena. Lena, something's going on with your audio, but that's Lena Green, and Lena is involved in a lot of community initiatives and activities and groups and things. And so we actually were just talking before the meeting started, but something happened, Lena, and we can't understand what you're saying. So thank you for being here, though.
Thank you.
So Lena, if you have a question or something, or want to tell us who you are with, then be sure to type it into the chat. And we are just glad that you are here today. Okay, so I see a couple more people you are welcome. So I see a few more people are streaming in. So as we move along, I don't want to prolong things. LeighAnn Brooks, or I'm sorry, first of all, is there anyone else that wanted to introduce yourself? Carlos?
Sharon, I'm not new, but is it okay if I introduce myself? I'm Kiona Cox, and I work with Cancer Services, and I am the Southeast Liaison. Thank you.
Thanks, Kiona. Now, was Carlos going to introduce himself? Carlos looked like he took himself off mute to say something, but I'm not hearing anything. So I'm not sure if that is Carlos Clapton that I met yesterday, or if that's another Carlos. But welcome, Carlos. We are glad.
Can you hear me now?
Yes.
I don't know why my audio wasn't working right, but I think you might have just said it, but nonetheless, I'm Carlos Clapton. I just started with Neighborhood Health Clinic about a month ago. I'm the communications and brand coordinator. I'm taking place of Katie. I believe she participated in some of these calls not too long ago. So I'm in her place. I'm happy to be here and see what I can learn from all of you.
Thank you so much, Carlos. So if anybody remembers, Katie Murray used to work with Neighborhood Health, and Carlos has taken over some of her duties and kind of expanded some things a little bit. And so we are just happy to have him with us today. Thank you so much. And Miss Sandy, have you been here before?
I can hear Sharon talking in the other room, and I don't know what just happened to her, but she was asking Peyton. Okay, she was saying if Sandy Payton has been here before, if she wants to introduce herself.
Good morning. I've been here before, but I'm Sandy Payton from Come As You Are Community Church. Glad to be here. I will have to jump off in a few minutes as I have an 11 o'clock appointment.
Okay, thank you. Am I still frozen?
Yes, Sharon is still frozen. I can hear her in the other, but if we can have LeighAnn Brooks present, that would be wonderful.
Yeah, I can totally do that, and definitely tell me if my computer freezes, because that's happened to all of us for sure. So again, thanks for having me today. And I just wanted to connect with you, share a little bit of information about diabetes and how it is impacting our community, and what maybe we can do about it. And then obviously leave time at the end for some questions, or connections, or whatever might be on your mind after I give you a little bit of details here. So let me see if I can share my screen with you. Okay. All right, so it says you can see my screen. Let me make sure I get this in the right view for you so I can see you and talk a little bit at the same time. So we'll go back here. So again, this is my name. I know I spell it unusually there. So and my title, and then my email, I'll have that on the last slide as well. So if anything, piques your interest today, or you'd like to reach out, please do so. One of our big initiatives at Parkview with our diabetes prevention, our diabetes care, screenings, everything that we do related to diabetes and preventing it and treating it really kind of falls under my realm. And so happy to connect with any of you or any of the other organizations that you're a part of moving forward. So I just wanted to give you a little bit of data, and this I found on our own Allen County Health Department website, and then utilizing the CDC data, the most recent data for comparing, national statistics here. So it's no surprise to anyone, I'm sure, that the majority of people in the United States are either overweight or obese. I just wanted to kind of share with you where Allen County sits, not just the state, but our county specifically, compared to the United States. So you can see about 70% of the people, and again, these are the most recent statistics available, which a lot of them were about 2020. So there's a little bit of lag time there. So this could have changed, but about 70% of people living here in our community in Allen County are either qualifying as overweight or obese. And in the United States, in comparison, that's about 66% of individuals. So we are a little heavier than the national average. When they look at that, they're looking at BMI. So a BMI of 25 or higher is overweight, and 30 and higher is obesity. So it's not just weight, though. It's some of the other things that are maybe contributing to that. We can make a difference and an impact as a community with lots of these things, with our different initiatives and our different organizations. So nutrition insecurity, that's kind of the term that we have started using here at Parkview. You might have heard it called food insecurity. It's really not just the food that is, the problem. It's really, they don't have access to, even when they can get access to food, they aren't necessarily getting the access that is to the food that is the best nutrition for them. So definitely healthy nutrition insecurity. So again, you can see we're about 2.5% different here in Allen County, or higher with our nutrition insecurity than we are across the United States. And this is definitely an initiative that we are taking to heart at Parkview. People can't be their best selves and control their diabetes and prevent diabetes if they can't get quality nutrition that they need. In addition, hypertension oftentimes is what we call a comorbidity with diabetes, which means they come together. A lot of times I've described diabetes as the gift that keeps on giving. You have diabetes, then you have high blood pressure or high cholesterol, or heck, then you have all these issues, and now we've got depression or something else that we're battling. So hypertension, again, we are a little bit better here in Allen County with that. So we've made some strides there. But when we have diabetes and hypertension, we can really accelerate the rate at which we develop complications. So it's important for us to keep a pulse on that, in addition to how many individuals are coping with diabetes as well. Our physical inactivity is a little bit higher than the national average here. One of our key metrics that we are helping individuals who come to our diabetes services at Parkview deal with is really setting goals around their physical activity. And you know, not necessarily, oh, you have to join a gym or you have to run 3 miles a day or anything like that, but just working to do little things to incorporate activity and more activity into their day. For example, taking the stairs rather than an elevator, or whatever it is that they can do to make strides and move the needle a little bit and improving their activity. So then as we kind of really dive deeply into diabetes, you can see that in the United States, we have about 11% of the population that has been diagnosed with diabetes. In Indiana as a whole, that's about 12.3% of the population. When we get down to just Allen County, we're looking at a little bit more, about 13% of our population. And then when we really take a deep dive into those social determinants of health, socioeconomic status, individuals in Allen County who have an income of less than $25,000 a year, they have an incidence of diabetes that is 19%. So you can see often these individuals maybe aren't getting the support or the care or the health care, whatever it is that they need to prevent and you know, work to improve their diabetes. So really important statistics there. You know, that's kind of alarming, and this is where, you know, our service line and Parkview as a whole really want to make a difference in our community. So I've got some numbers here for you, and if you look at these, so 70% of your quality and quantity of your life is directly related to your lifestyle. It's how you eat, it's how you exercise, it's if you get enough sleep, all of those things. 70% of it you can control with your lifestyle. 6.3% of people actually do that. And what I mean by that is if we know that 70% of our health and our quality of life and our quantity of life is related to our lifestyle of eating healthy and exercising, vegetable consumption, not smoking, all those things, there's only 6.3% of individuals who are putting those pieces together and holding together that lifestyle that makes that lower risk for developing something like diabetes. So that in and of itself is our challenge. It is getting people to not just understand and you know, educate them. Some of them know, they're just not doing it. So it's education and motivation and challenge to get individuals to be able to incorporate those lifestyle factors into their day-to-day world. So the burden of diabetes, and not only diabetes, but pre-diabetes. So let's take a look at that. 33.5% of the population has pre-diabetes. So that's 1 in 3 people has pre-diabetes. It's estimated that often individuals will have pre-diabetes or even early stages of diabetes for maybe 5 to 10 years before they are diagnosed. So 90% of that population that is living with prediabetes has no idea. And unfortunately, that's where we can make the biggest difference. We can intervene with some of the lifestyle changes and make sure that we are preventing that diabetes from happening. Now, because prediabetes, because 90% of the population doesn't know they have it, it's really difficult to pinpoint exactly how many people in our county would have prediabetes, but it is estimated by the numbers that we are looking at that about 140,000 people have pre-diabetes that are living in Allen County. And again, 90% of those folks have no idea. So when we look at diabetes in comparison, about 13%, as I said, of the individuals in Allen County have diabetes. So again, there is a population that may have type 2 diabetes and isn't aware of it. So it's estimated when we look at Indiana, again, we had 12.3%, but it's estimated that there's another 2.6% of people in Indiana that don't know that they have diabetes. So it could be as high as about 15% of individuals in Indiana with diabetes and they're unaware. And then on our Parkview registry, we have about 65,000 people that are now diagnosed with diabetes. And the Parkview registry just pulls together anybody who has been seen at a Parkview facility that has a diagnosis of diabetes. They land on this registry. And what we can do is break the registry down, not by person per se, but by some demographics. So where do they live? Or have they seen a doctor? Do they have a primary care? Have they had lab work done? Those types of things. So about 65,000 people on that registry right now. And again, another alarming statistic is that about 28.2 deaths per 100,000 people in Allen County are directly related to diabetes complications. So again, very important for us to make more people aware and to increase that testing and awareness and allow people to have that intervention earlier to prevent the diabetes from developing. So about 50% of people are susceptible to diabetes or at risk for diabetes and pre-diabetes. So it's really important that we know how to assess individuals for this and make sure that they know how to assess themselves, their family members, and so on. All right, so what are some of the next steps? What can we intervene? What can we do? And what can we work on again to move that needle to make folks more aware? So a few numbers I'm going to put on the slide here. So one time per year, that is how often, the minimum number of times, how often someone should see their primary care provider. So getting established with a primary care provider and then seeing them a minimum of 1 time per year. Adults need to be screened routinely, especially with family history and so on, to make sure that we are staying ahead of any labs that would indicate pre-diabetes or diabetes, focus on the hypertension, all of those things we've discussed. 150 and 75. So the recommendation currently is 150 minutes of physical activity per week. And at least half of those, so 75 of those, should be vigorous activity. Now, you don't know how to tell the difference? Really easy way. If you are exercising and you can talk to your exercise buddy or whomever as I'm talking here, that's not vigorous exercise. But if you're exercising and you're having trouble getting the sentence out, short, kind of the short of breath, can't catch your breath as in trying to say a whole sentence, that indicates that you're exercising at a more physical level. So you can kind of do a talk test basically and figure out whether or not your activity is vigorous at that time. That's one of the best ways that we can help our body prevent diabetes. Next number here on the slide is 5. That is the number of servings per day of non-starchy vegetables that we need. So not potatoes, not corn. I know we live in Indiana, but not potatoes, not corn, not even really sweet potatoes, those starchier vegetables. We need all of the non-starchy vegetables, and we need at least 5 servings a day. A lot of people have no servings a day of vegetables. And so this is something that we need to make a difference in. Again, hopefully we're doing fresh or frozen, canned if we can't do anything else. And if we do the can, making sure they're rinsed off so that we don't have a lot of that sodium in there. Those are ways that we can, have vegetables and still keep it affordable, not all the sodium on it. 7, that is the number of hours per sleep per night that individuals need as adults. So this is really important, and many people don't realize it. We have a lot on our plates, and so we tend to skimp on our sleep. Sleep's very important in preventing diabetes. In our sleep environment, it's ideal if it can be about 65 degrees. If we go to bed and get up about the same time routinely, even on the weekends, we need a dark environment, an uninterrupted environment, and then practicing what we are now calling sleep hygiene. So it's not playing video games in our bed or watching TV in our bed or playing on our phone in our bed. It's reserving our bed and that space for sleep rather than for entertainment. So kind of dividing our spaces in our home. I've got another 7 up here. So this 7 represents 7% of your body weight. If you are above your ideal or you fall into that overweight or obese category, losing 7% of your body weight will help manage your cholesterol, your blood pressure, your insulin resistance. All of those things will improve if you lose just 7% of your body weight. Many people think, oh my gosh, I'm overweight, I'll never lose all this weight. You don't have to lose all the weight to make a huge difference in the way your body is processing sugar and glucose and its functionality. So 7% of your body weight makes a huge difference. 0. 0 represents the number of sweetened beverages we want individuals to have each day. When you look at soda, for example, that's sweetened, and you look at some of the sweet teas and the sweet floofy coffee drinks and things like that that we consume, all those calories add up, and sometimes people don't think about the calories they drink contributing to their weight, and certainly that sugar in those drinks contributing to their risk for diabetes. So if we can eliminate sugary beverages, that is going to make a huge improvement. Okay, so a couple things on this slide. I'm going to share with you some of the diagnostic criteria here for diabetes and prediabetes. So one of the tests that we use to diagnose diabetes is called an A1C test. Now that's just really lab terminology. I can't give you the name of the A and the 1 and the C, but basically this is an average blood sugar. What percentage of your blood is saturated with sugar? Now normal should be 5.6 or less. So you can see here for prediabetes, which is the P at the top with the yellow stoplight, we are in the pre-diabetes zone when that A1C goes to 5.7 all the way up to 6.4%. So that is diagnostic of pre-diabetes. When you look at diabetes, it is 6.5% and higher. And the higher the number, the thicker that blood is with that sugar. So think of it as normal blood sugar. Blood consistency is like water, and then we can get up to syrup and honey and molasses as we get all that extra sugar circulating, which can then cause damage to our bodies. So as we look at the actual glucose or sugar number, if your physician has tested your fasting blood glucose or sugar, 100 to 125 indicates the pre-diabetes, and anything over 126 indicates diabetes. So in the United States, there has been a benchmark set of 91%. We want 91% of adults to be screened with an A1C so that we can see their risk of diabetes or diagnose them with diabetes. Right now in Allen County, we are at 86% of our adults have been screened. So we need to move the needle on that one a little bit as well. We're about 5% behind. So we need to make sure that we are testing that more frequently and making people more aware of what's going on in their body. So currently in Allen County, 86%. US benchmark, we need to get to 91. So what are the next steps? These websites here both have risk tests that you can take. So you can go to diabetes.org and the risk test, or you can go to the CDC and go to their risk test. And they're very simple little quizzes. You just answer a few short questions and it will total up your score and let you know if you are at risk for diabetes. And again, the higher the score, the more at risk that you would be. So my challenge to you today would be to share that test with 10 people in your circle. So coworkers, friends, family, share it with 10 people and make sure that they take that risk test and determine whether or not they're at risk for diabetes and then follow up with their physician. So share that with 2 people now. And by the end of the day, do 8 more so that you've got a total of 10. And everybody you share that with is 1 more person you could potentially impact and prevent diabetes. So 2 really easy ways to assess your risk. When you take that test, it'll look something like this. These will be your results here. So it'll give you a score. So this one says low risk, 2 out of 10. And then that individual can share that test so someone else can take it, and then it'll tell you more information about the test. If you had a higher score, for example, it'll tell you some key points here. So it'll remind you if you're at low risk right now, then these are all the things that you need to do. Get that 150 minutes of activity, watch your weight, healthy foods, all those things that we were just speaking about. So super simple way for somebody to assess and then follow up with their physician. Okay, so those are just a few slides that I thought maybe showed the importance of preventing diabetes in our own community. And again, like I said, I'll leave that slide up for a second so you can write my email down if you're interested in that. But at Parkview, we are, again, really working on our community initiatives. I have a new leader within Parkview system, and we are working to collaborate on several different initiatives. So let's see if I can exit out of this here and maybe just get back to, sorry, I don't use Zoom often enough, so I got to figure out how to stop sharing my screen so I can actually see you guys again. So hold on here. Okay, so are you guys able to see me, or are you just seeing my screen?
I I see you.
I can see
Okay.
you, LeighAnn.
Okay, perfect. Okay, I wasn't sure. So, all right. So, okay, so we are really interested in making sure that we are, like I said, meeting the needs of our community. We are looking at some initiatives. We had gotten some grants for iPad tablets that we will have. All of our classes since the pandemic have been on virtual, kind of like this on Zoom. So our participants are logging on from home, but we got a grant to purchase tablets. So we're getting about 20 tablets that will be connected to data, so that if we have individuals who don't have Wi-Fi at home, don't have a device that they can log on with, they could be loaned a tablet from us, take that home, log on to their diabetes education with an educator, whether it be a dietitian or a nurse, whether they're doing an individual appointment or they're doing a series of classes. They could be loaned that tablet to take to participate in that education, so that we don't want anybody left out because they don't have a device that they could do something in a virtual format. We also received a grant to do some remote patient monitoring, which is when a patient would be testing their blood sugar at home, that blood sugar would upload to our computer system. And if that patient had a severe low blood sugar, it would alert us, and then someone would be calling that patient immediately. It works with a call center. That person would reach out to them, almost kind of think like a lifeline button. That person would have a low blood sugar. Immediately within 30 seconds, somebody would call them. Are you okay? Have you gotten something to eat? Have you retested? And then we would get an alert as the diabetes educators that we need to follow up with that patient. Maybe that patient has too much insulin or had some other issue that they need some education on. So we've gotten those. We're working on a mobile diabetes clinic. So if you don't have transportation to get up to, the endocrinology office up at the North Campus, we'll come to you. How can we eliminate the barriers is really what we're looking to do for the community, so that we can provide resources and meet patients where they are. We're working on embedding our diabetes educators within the different medical homes that Parkview has around the community, so that, again, they don't have to travel if they want to see somebody in person. Really kind of putting the patient at the center of that care, rather than, telling them when and what they have to do. We have a few new roles on our staff as well. We now have a navigator. So if there's someone who is really struggling, a navigator, think of them as someone who is a diabetes educator, but they know how to find resources for patients who are struggling, how to get them into medication assistance programs, how to get them into like our Veggie RX program, for example, where they could get a box of vegetables a week, or other initiatives that we have going, get them the resources that they need. We also have a community engagement coordinator who is an educator with us who speaks Burmese, and she will be doing education within the community for our Burmese population. And not only is she doing the education, but then she is staying with them if they go to their provider and they need help understanding what the provider's saying about their diabetes. Or we have a lot of pregnant women who have diabetes and are Burmese, and she's following them through their care. So they're not just getting a translator, they're getting someone who can translate, but say the same person and understands diabetes and can support them throughout the whole thing. So it's someone who hears the message every single time, just as they would have heard it from that provider. So can connect more of the dots for them. And then,
LeighAnn?
yes.
Yeah, this is Sharon. Hey, everybody. I am now in Felicia's office. So that's what Felicia say. And she's right here with me. LeighAnn, we have a couple questions. I want to make sure we have time to get to those.
Yeah, absolutely.
Is that okay?
Yeah.
Okay. So Colleen is asking, how is physical activity defined?
So when we talk about physical activity, we typically will tell patients, it doesn't have to be something like, oh, I have to go to the gym. You know, a lot of people think a gym and for 1 hour and, you know, that type of thing. So we just define it as activity above and beyond what you normally have been doing as part of your daily life. So a lot of times I'll have somebody that says, well, I walk all the time with my job. Okay, but now you have pre-diabetes and we need to have that activity in addition to what you've normally been doing.
Okay, and then Irene wants to know, are you working with senior homes to implement your grants?
Yes, so Chad has several services that he has, he's my leader, our director of enterprise diabetes strategy, and he has several different places that he has been in contact with. If there is one in particular that you would like me to be aware of and focus on or reach out to, please email me and let me know. We would be happy to do that. I think that would be a great opportunity to meet the needs of those seniors.
Okay, and I had a question while you were going through, that was an excellent presentation, by the way, very informative. And so I learned quite a few things with that. So you were talking about how you mentioned that 86% of the people in the county, I presume, are being tested, and the goal is to get to 91%, right? Okay, so I wondered how that works in conjunction with some of the other figures you gave, because you were talking about how all of these, so many people are pre-diabetic and unaware of it.
Yes.
So I mean, the 86 to 91 didn't seem like a large percentage, but then the other the 140,000 people who didn't know. So obviously I'm understanding that.
Well, I think what it is, because as I typed that, I kind of had the same thought process. And what I think it is, it's making the awareness that it's not just one time. So this is 86% of our population has at some point that we know of had an A1C done, for example, but that might have been 5 years ago. Or, you know, so we really need to make sure that we're getting to 91% and we're getting that every year, I think is the disconnect. So we may have had 86% of the population that has had that A1C done at some point, but not every single year. And that's the difference. If we were at 86% every single year, I agree there would be a very different outcome with who had been diagnosed and who actually knew they had diabetes or pre-diabetes. So I think that is the message there. That's the disconnect, is that a lot of individuals will have it, but not have it done routinely. And it needs to be a part of every year, that blood work.
Okay. And then another question that I had, y'all better get your questions into the chat or I'm going to hog it all up. So one other question that I had, I thought was interesting. You were talking about the importance of sleep when it comes to diabetes, and it needs to be 65 degrees, and that's cold for me. Like heat. So talk a little bit more about the importance of how we sleep and the temperature at which we sleep and how that plays into diabetes somehow.
So really what sleep does is it really resets our body. And when individuals aren't getting enough sleep, they tend to be obviously more tired throughout the day. One of the reasons that people will overeat is fatigue. So oftentimes, if we really listen to our body when we go to eat something, it may not be that we actually have physical symptoms or signs of hunger. Like it may not be that when you say, oh, I need a snack, that your stomach is growling. It's probably that either you're bored or you are tired and you want something to, you know, pick you up. Look at like the Snickers commercials, you know, and Snickers will pick me up in the afternoon. So those types of things that we really associate the food with. So that lack of sleep is really causing our body to try to compensate in other ways. So our body's trying to keep us awake. Oh, I need another cup of coffee, or I need a donut with my coffee, or I need something, a sugar rush, I need whatever to get me back in the game. And so we're really doing ourselves more harm by not getting enough sleep. As far as the temperature, now certainly, you know, everybody would be a little bit different. My husband would probably balk at that, whereas I think 65 would be blissful, but it's really the point is, so the room is at the temperature where you are comfortable. You're not waking up in the night too hot. You're not waking up too cold. You have this even temperature that feels right through the night for your body. So if you wake up multiple times during the night, you know, is it because you're warm? Is it because you're cold? You can't find your blanket, you know, whatever. So finding the right temperature so that that temperature doesn't interfere with or interrupt that sleep that your body's trying to get, because that's our body and our brain really resetting and rebooting. So 65 degrees may vary from person to person, but usually if you are going to be someone who's under the covers at night, you might actually want it a little bit cooler if you put lots of blankets on, so that you're not waking up sweaty in the middle of the night and that's disrupting your sleep. And again, as we look at that in correlation with diabetes, again, that lack of good sleep, that lack of consistent quality sleep, you know, routine, again, listening to your circadian rhythm, same time for bed, same time to get up. If your routine is all over the place, you know, sometimes I go to bed at 9 and then 10, and sometimes it's 1 on the weekends or whatever it might be, that's really changing and confusing to your body. And so again, then on those times where you get less sleep, you might be eating more, or you get less sleep and you don't have the energy then to do the exercise that you know your body's going to need. So those things all play in then to your weight, and then of course then to your risk for diabetes.
I see. LeighAnn, thank you so much for answering our questions. Thank you for that great information. I don't see any other questions in the chat. LeighAnn, if you could put your contact information in the chat, that way we can bug you later on if we do have some other questions. I need to go and look up circadian rhythm for one, so that I can know what that means, but I think I got the context of it. Thank you so much.
One last thought I'll leave you with. The other new staff member we have is a lifestyle change specialist. So if you or someone that you know has diabetes, maybe you've been to education, been through classes, and you're still struggling, we have someone who can journey with you hand in hand, kind of like a coach, through your journey with diabetes. And we are not charging anything for those services at this time. So I think that's a really huge benefit for folks who feel defeated, feel like they haven't been able to make the changes they want to make. You know, we can hook you up with an expert now to help you and to help, you know, all of our patients make those changes. So thank you for your time. Please reach out to me. I will put my information in the chat, but please let me know if there's any other questions that you have. Even if you think of them next week, feel free to reach out. And I appreciate your time today. Thank you so much.
Thank you, LeighAnn, for that awesome presentation. Very informative. I talked with LeighAnn and Chad Shire, who she mentioned about a week or two ago, maybe. Things run together because Health Visions does some diabetes curriculum, some evidence-based diabetes curriculum that, you know, we were talking about in ways of how we could complement the more intense and medical things that they do. So we appreciate you and what you are doing in the community. Now, I have my mask on, y'all, because Felicia's right here. I don't want to infect her with anything. But now I want to go on in the agenda and talk about some partner sharing. The first thing I want to share from Health Visions is that we are going to be hosting a mental health expo, in conjunction with Come As You Are Community Church on May 21st from 10 a.m. to 2 p.m. Sandy with Come As You Are, who is very active in the community, she did need to leave today, but we're going to be hosting that, and we are looking for partners who might want to be vendors with that effort. And so it is a mental health expo. There will be a focus on mental health, but we will also, of course, be doing some physical, spiritual, emotional offerings as well. So and we want to do some health screenings. So if you want to come and join us, offer some health screenings, perhaps for A1C, so we can get some more people tested, weight, high blood pressure, and all of those things, as well as, you may want to highlight some of the services that your organization offers, then we would welcome hearing from you. Just email Felicia, fsay@hvusa.org, or me, and we can talk a little bit more about how we want to incorporate what you are doing with that health fair. May is Mental Health Awareness Month, so we want to do that. And also, Patricia, you want to mention the Aspire series for next month?
Hello, everyone. My name is Patricia. I am going to mention a little bit about the Aspire series. Next month, we're talking about self-esteem, what it is, how to achieve and maintain healthy self-esteem. It is a 3-part series. It starts on April. Let me get my dates here, make sure I'm telling you the right dates. We're looking at April 14th, 21st, and 28th. That is noon. It's kind of like a lunch and learn. It's from 12 to 1. And that third session on the 28th is celebrating yourself. So hope to see you there.
Okay, thank you. Sorry, working with the new laptop. Okay, so am I missing anything else? Team, Peggy, Lupita, y'all have something to share? Felicia. Food Exodus Project. Thank you, Felicia. So this is our third showing of the Food Exodus Project. The first 2 have been amazing. People came out in a blizzard. I'm not even exaggerating. They came out, the snow was coming down, y'all, to this program last month. So we have our third showing next Wednesday at Indiana Tech from 6 to 7:30. Indiana Tech's theater will be showing the 40-minute Food Exodus documentary. It is, if you have been under a rock for the past 3 months and haven't heard about this, but the Food Exodus Project is a documentary on food insecurity and food deserts in Fort Wayne. We went around, we interviewed experts and people. Denise was in it, so you know it's good. Denise Porter was in it, y'all, and she was given all kinds of wisdom. And so that is going to be showing next Wednesday. And then we're going to have a community conversation with some Indiana Tech professors who've been studying this, as well as some folks from Parkview, Michelle Bodrab, and Dr. Diana Jackson, who she may not be on today. And they are going to be talking about some of the implications of food deserts. So please come out, join us. It is free. We'll see the documentary, then we'll have the community conversation. You don't want to miss it. I think this is going to be our last in-person showing with the community conversation for a time. We may do some other stuff in the fall at some other institution, but for right now, this is gonna be it, y'all. So this is your opportunity to engage in the discussion. Food Exodus Project. Anything else? Peggy, Lupita.
I think it's wonderful, all these programs that Parkview has started, and I took notes of everything, because in my case, I would say 80% of my clients has diabetes. Yesterday, just one of my clients came to the office and we were talking about she couldn't go to a special dietitian that the doctor sent her because she said she couldn't afford it. And then she need to do exercise, but she said, I don't want to go to do exercise by myself. And we were talking about how that is not helping to her. She has been told that she's pre-diabetic, but
so she fits into the profile of what LeighAnn was talking about with the pre-diabetes. And I'm sure we all have those kinds of stories where we've met somebody, we know them, they are pre-diabetic. And so again, LeighAnn, thank you. And LeighAnn's information is in the chat that we can kind of discuss some things further with her. I want to go on with the partner sharing. Betsy Cashmer in the chat is, hey, Betsy. She came in a little bit later. She's got some stuff in here. Do you want to read it or do you want to say it?
I'll just, in case you haven't been to the chat, I've been working with a friend of mine who has got this new program up and running called Path for You. And it is available at the Lafayette Health Center and also at Planned Parenthood. And so people have access to free birth control, including IUDs, which are like $1,000. So people can choose what path is appropriate for them and to talk to a healthcare professional. They also have a chat line and a website with a lot of information. So if you are aware of people who would like that information, and I've got quite a few posters. So if you want to put it in the chat that you'd like me to drop them off at your place, I will be more than happy to let you have them to put up on your bulletin boards or wherever.
Awesome. We might be able to use some posters.
I thought you might. That's why I thought I'd mention that. So I will.
Thank you.
I will hook you up.
And Ms. Sharon, it's Kiona. I just want to put out there as well that at the Impact Center, New Covenant, we're doing Zumba every Tuesday with Kristen Thompson. She owns K Monique Studio, and we've been having a great turnout and a great time. So it's free to the community. So come on out. It's from 2:30 to 3:30. And I've given Felicia the cards already. So, and then Diane, Roger, she's doing yoga off of Capitol and Anthony. So please come out. All these programs are free and you do not have to have cancer to come to them. Thank you.
So physical fitness is not, I mean, that helps with cancer as well as diabetes, which we learned today. So we need to get physically fit. In the chat, John Garner is talking about Bright Points Covering Kids and Families program, and they are continuing to help people with Medicaid, Marketplace, and SNAP enrollment. So if someone needs help enrolling, Bright Point is there. They are the ones to help with that. And contact him for more information. That is right in there. We got some follow-up questions, Kiyonya, for the Zumba. And what else we got? Anybody else? Oh, Kim, the health fair this weekend on Saturday at Shepherd's Hand. Talk a little bit about that. We're going to be there.
Yes, we're super excited to have you there. And the National Kidney Foundation will be doing kidney screenings. And so, LeighAnn, we actually have a few Parkview nurses who are volunteering with the National Kidney Foundation, and they will be doing blood glucose, blood pressure, as well as a urinalysis. There will also be other providers as well who will be available, but if anyone is over 60, has high blood pressure, has high blood sugar, they are at increased risk of kidney disease. And so we're definitely encouraging folks to come out and learn what their risk is, and then also to get connected with resources if they're at higher risk for kidney disease.
And where's this at again? Shepherd's Hand, and where's this?
Yep, the Shepherd's Hand. And I dropped a flyer in the chat, and it is here. I'll actually do that again here real quick. And it is here on the south side. It's on Anthony Street, 1231 South Anthony, and it's from 10 a.m. until 1 p.m.
Thank you, Kim. Anybody else? We've got 47 seconds. Nobody. We have free tax prep at the libraries in the chat. So take a browse through the chat. Connie, you had something?
I can't type fast enough, but it's Fort Wayne Medical Society Alliance Cinderella Dress Day this Saturday at the Grand Wayne Center. And there's a health fair that goes along with that. So it's free prom dresses. There's no registration needed, and you can get shoes and accessories. And like I said, a health fair, and Super Shot will be there giving HPV immunizations.
And if you have not opened up your email and seen the Health Visions Midwest newsletter for March, you've got to open that up. There's a story in there about Connie, our very own Connie who just talked, and Kim and their partnership to give free diapers to people who bring their babies in for immunizations on time. So take a look at that. There's of course some other informative information in there. Colleen has put in the chat about another diaper bank with Connect Allen County on Rudisill. So all kinds of information flowing. It's 11 a.m. y'all. If there is nothing else.
Miss Sharon, okay. Someone asked me, I'm sorry, one more thing. The Zumba classes is at New Covenant. It's the Impact Center. It's right down the street from the Hudson Castle Library. And right now we're going from 2:30 to 3:30 p.m. Someone asked that question. So
New Covenant Church is on Paulding, am I correct?
It's 3420 East Paulding Road.
Okay, there you go. So that's what you need. You can put that into your GPS and head on out there. All right, people, thank you so much. We will see you next month. Check out your newsletter. Check out our news and events that Felicia sends out every other week and get some information. Have a good rest of your day. Bye.
Bye.